Welcome back to FAMWISE. We are talking about how to plan for a pregnancy today. Let's get into it. So when you are planning for a pregnancy, each cycle you have about a 25% chance to naturally conceive with no other health issues. So that means that both you and your partner are healthy. And if you factor in other health issues with either partner, the chance can go down. So this 25% chance can differ depending on your age, your health, and your genetics as well. So although we were taught that it's very easy to get pregnant, a lot of couples do run into fertility issues. And on average, it takes approximately 4 months to get a positive. And a lot of people do get pregnant right away, but a lot of couples find they struggle with fertility challenges. So although you might be in your fertile window, you see cervical mucus, you have intercourse during this time, and there is sperm present, you might not necessarily get pregnant. Timing sex accurately is very, very important because as we learned, there is only a 6-day fertile window. And therefore, the best time to have intercourse to achieve a pregnancy is during that fertile window. So all the pre-ovulatory mucus days, either your ES or EL, are both fertile. And although both these are fertile, the peak mucus, so that stretchy, clear, lubricative, or very watery mucus, is optimal for conception due to the specific qualities that encourage fertility. So this fertile window will include ovulation itself and the 5 days prior, and that would be your window of opportunity to achieve pregnancy. Sperm can live in cervical quality mucus for up to 5 days, like we've learned, and once ovulation has occurred, that egg has been released and it's no longer viable, so it's been past that 24-hour period, the chance of pregnancy falls to about 0. And this is why it's so important to have intercourse leading up during your fertile window, leading up to ovulation. So if you have intercourse outside of that fertile window, there is no chance of pregnancy. So you need to make sure that you are timing intercourse properly because you'd be shocked about how many couples are having sex at the wrong time. So when you have ovulated, if you have had intercourse and cervical mucus is present during that fertile window, this cervical mucus is going to rapidly transport sperm towards the egg or towards the cervical crypt so that once that egg is released, it is ready and there to meet the sperm. So the sperm will swim into the fallopian tube, and that's where it's going to meet the egg. So that fertilization happens inside the fallopian tube within a 24-hour period of that egg being released. So several thousand sperm try to penetrate the egg, but only one is successful. And there's actually some really cool research about how the egg actually chooses which sperm it wants. The now fertilized egg, called a zygote, continues to travel down the fallopian tube and undergoes multiple cell divisions, becoming a blastocyst by the time it reaches the uterus. It starts to implant into the endometrial lining approximately 5 to 10 days after ovulation. So you might see that implantation spotting or get a little bit of cramping. And the start to finish of implantation can take about 3 to 4 days until it is fully burrowed in and is now an embryo. Cervical mucus makes the perfect pH for sperm to survive because remember that your vagina is pretty acidic if cervical mucus is not present, so sperm will just die. It helps keep sperm alive for up to 5 days. It rapidly transports sperm into the cervical crypts, filters out poor quality and abnormal sperm, and prepares sperm for fertilization, aka through capacitation. So capacitation refers to the cervical mucus allowing sperm to actually have the capacity to fertilize an egg. So our eggs are the size of a period on a piece of paper if you were to write out a sentence and then finish it with a period. And sperm you cannot see with the naked eye. So in order for sperm to actually penetrate the egg, they have enzymes in their sperm head which gradually breaks down that barrier. And cervical mucus allows that to happen. And your cervical mucus, this EL and ES, are both fertile, and that is your primary sign of fertility. So pay attention whenever you see that, and that is your cue to have intercourse. So in order for you to have extra confidence in what you are seeing with your biomarkers, some people like to use those ovulation predictor kits. So remember that this is a measure of your LH surge, and ovulation is likely to occur 24 to 36 hours later. So don't wait until you see a positive LH surge to start having intercourse. So some women experience false positives due to elevated LH as seen in PCOS, and then sometimes you can even get a false negative if your LH has not reached the threshold that the test has. So you can't always take these tests as absolutely accurate. So therefore, mucus should always be your primary biomarker, and the ovulation predictor kits are second. Remember that the LH surge does not confirm ovulation has actually happened as well. So if you see a positive LH test, it doesn't really guarantee that you will actually ovulate. Now, many women like to rely on charting apps and things to help predict their ovulation. This can be helpful to help track your period, but now that you know how to chart, you can more accurately chart this and track this. So ovulation does not typically happen on the exact same day every single cycle, so you should expect to see fluctuations in ovulation from cycle to cycle. Remember that your cycle can change due to different stressors. It could be early or later, and even if you do have regular cycles, your ovulation day can differ a few days each cycle. So having sex based on previous ovulatory patterns could reduce your chances of conceiving. Mucus should always be primary, and if you're using an app-based method, which often uses the rhythm method for predicting ovulation, remember that you are not actually connected to this app, so therefore it might suggest the wrong fertile window because you may have ovulated earlier or later. So if you're looking to optimize your chances of conceiving, you want to chart your fertile signs every single day, pay attention to your POC, that point of change, have sex when you see cervical mucus, make a point of having sex on ES days specifically. As we know, peak day is highly correlated with the day of ovulation with plus or minus 3 days, and make sure you're always using your mucus as your primary sign before apps or those OPKs, and confirm ovulation has taken place with your basal body temperature. Now, if you have been trying and you are now post-ovulation, you've confirmed that ovulation has taken place through your cervical mucus and basal body temperature, you can see these signs. Now, not everybody is going to get all these signs. You might only have a couple, you might have none. It really differs per person and also per pregnancy. So sometimes you can see that implantation spotting, which approximately occurs 6 to 11 days post-ovulation and occurs in 15 to 20% of women. So this is a very light spotting. Usually it's just maybe enough for a panty liner, maybe nothing. You might have only seen it when you wipe. It can be red, brown, or pink. And this tends to last for like a day or two, maybe 3 max. Usually it's just a day. Cervical position will typically remain high and soft, but closed in early pregnancy and will firm up later in pregnancy. Your basal body temperature will not drop after that luteal phase, so your luteal phase will just continue, and it might rise beyond your usual post-ovulatory temperatures. So if your luteal phase is approximately 12 days and usually you see a decline in temperature, then you'll get your period. It will just keep rising or will keep that high basal body temperature. So a lot of women using this method just track their basal body temperature, and they actually use that to confirm their pregnancy. You can obviously use a pregnancy test to extra confirm that, but a lot of times they find out that they're pregnant using their basal body temperature before they even test. Other symptoms include breast pain or fullness. That is very, very common. Cervical mucus changes is common as well. So you could actually see more like fertile quality looking mucus, so like more E mucus. It could be clear, stretchy, could be very watery, and that can be due to quick cervical changes and rapid hormone rises. You could get light cramping, some PMS symptoms. Nausea is one we've all heard of. Bowel changes can happen as well due to those rapid fluctuations with the hormones. You might find you're constipated or you get diarrhea. You could have moodiness, sleep disturbances, and appetite changes. And of course, if you have missed your period, you can test using a pregnancy test. You can start testing at about 10 days post-ovulation as well, or that 2-week mark or at your missed period. And what a pregnancy test is testing for is that hormone HCG. Now, that hormone is going to start being produced once that embryo has implanted and will rapidly rise in the blood as pregnancy continues. Now, unfortunately, over the past about 60 to 70 years, there has been an alarming decline in sperm count and quality. So it seems to be a global trend, and from the 1940s to 2011, the average sperm count has declined 58% from 113 million sperm per milliliter to only 47 million sperm per milliliter. So that's about 60% less sperm now than the average male had in the 1940s. And we have to remember that out of all infertility cases, male factor infertility accounts for 40 to 50%. So if you and your partner are having difficulties, it's important for them to be evaluated as well. So you can see in this picture the normal sperm on the left-hand side and the abnormal sperm on the right-hand side. So some have 2 tails, no tail, some have 2 heads or a small head or even no head, and they look pretty different than the healthy ones on the left. So these are the suggested optimal sperm parameters. These metrics are typically evaluated during a semen analysis, which assesses male fertility and helps to identify potential issues with sperm production or function. When we are looking at the optimal sperm parameters, we look for a concentration of 40 to 48 million sperm per milliliter, and this refers to the number of sperm cells present in 1 milliliter of semen. A concentration within this range is considered optimal for fertility as it indicates a sufficient number of sperm available to fertilize an an egg. Concentrations below this range might suggest reduced fertility potential. A minimum motility of 50 to 68% is optimal, and motility refers to the ability of sperm to move actively and efficiently, and this is crucial for sperm to travel through the female reproductive tract to reach the fertilized egg. A motility rate of 50 to 68% means that at least half of the sperm in the sample should be actively moving, with a significant portion displaying strong forward motion. So a minimum of 12 to 14% normal morphology means that this percentage of sperm in the sample have the proper size and shape necessary for fertilization. This includes having an oval head, a long tail, which helps sperm penetrate and fertilize an egg effectively. Now, the WHO guidelines, on the other hand, are less optimal, and this is the lowest end of the spectrum that you can use for assisted reproductive procedures. And this is because it's harder to do IUI with low quality sperm. So to optimize chances of conceiving, we look for 40 to 48 million because the vast majority of sperm men produce are abnormal. So the WHO guidelines consist of 15 million sperm per milliliter, 40% motility, and 4% morphology. So basically they're looking out of every 100 sperm, only 4 look normal. When we are looking at your egg quality, these are some red flags that might make it more difficult to conceive. So if you have a short follicular phase of less than 10 days, a short luteal phase of less than 10 days, if you have a low basal body temperature, if you have erratic or irregular cycles, delayed or absent ovulation, a little bit of spotting can be normal a day or two before your period, but if you have spotting over 2 days, that can be something to look into and may suggest low progesterone. If you experience light periods, moderate to high PMS symptoms, low to no cervical mucus, weak positive ovulation predictor kits, short overall cycle length, less than 24 days, or a low temperature shift post-ovulation. So these things can all suggest different hormonal abnormalities, hormonal imbalances. It could be due to excess stress or a nutritional imbalance or some other issue that we need to take a look at. Next, we have some cycle green flags that can support optimal fertility and conception. So if your period is 24 to 36 days long, if your period bleed lasts 3 to 7 days with at least 1 to 2 days of medium to heavy bleeding, if your period is different shades of red, it's maple syrup consistency, has no frequent or large clots, if you experience minimal to no spotting in the days leading up to your period, minimal to no cramping, and minimal to no PMS in the days leading up to your period, 5 to 6 days of E-quality mucus, including 3 to 4 days of ES mucus, so that's stretchy, clear, lubricative, or watery. And again, this can change due to different health issues. This can change if you're on different medications, your diet, post-birth control, and your age. So that can be normal depending on those things for you. We want to make sure that ovulation is occurring, your luteal phase is at least 10 days long, and you have strong post-ovulatory basal body temperatures. All these things can suggest that hormones are imbalanced. They are all hitting their proper levels for different cycle events to occur. Your uterine lining is thick enough to support an implanting embryo and can suggest that nutrition and stress are in optimal ranges. So if you find if your cycle has a bit more of those red flags than the green flags, luckily there is lots we can do to help out our hormones, sperm, and egg quality, and a lot has to do with similar nutrition and lifestyle needs. So when you're optimizing your egg quality, your partner can also optimize their sperm quality using similar methods. And you'll want to commit to these changes for a minimum of 3 to 6 months for sperm and egg quality. That is because it takes 3 months for an egg to mature, and same for sperm to fully mature. So we want to make sure that we are incorporating lots of vitamin A rich foods, which are essential for normal reproductive function. And animal studies can actually give us a good insight into this as well, because if male rats receive no vitamin A, they actually stop producing sperm altogether. So vitamin A rich foods you can include are found in orange vegetables like squash, sweet potatoes, and carrots in the form of beta carotene, but your body has to convert this over to retinol, which is the active form of vitamin A. So based on your genetics, this might not be sufficient, and therefore you need to also be getting that preformed vitamin A, and the only way to obtain this is from animal products like dairy and meat, and liver and cod liver oil are also excellent sources. There are fears of getting too much vitamin A during pregnancy, but these fears stem from synthetic vitamin A from supplements. Obtaining from whole foods is preferred and allows you to obtain other supporting nutrients. Vitamin A and vitamin D work together to support each other's processes in the body, and when in balance can reduce toxicity. And be sure to check with your doctor about how much you personally need. You also want to be incorporating fertility superfoods, which we will touch on in the Healthy Cycles module about lifestyle and diet. And for your partner, make sure they are keeping their boys cool, because Even 1 to 2 degrees or more above the ideal range can impair production and quality of sperm. This includes tight underwear, hot tubs, summer jobs, and activities. You'll also want to work on quitting smoking, so that includes cigarettes and marijuana, and limit or quit drinking alcohol as well. Reducing your soy consumption might be something to think about as well, because research shows reduced testosterone and sperm quality parameters due to the phytoestrogens found in soy. So this may potentially disrupt male endocrine systems to some degree, and for women, this can affect everyone differently. So it can help support estrogen. It really depends on what your personal levels are and your genetics are. So this might be something that you experiment with. So see if it has any effect on your periods. You'll also want to try your best to limit your xenoestrogen exposure. So that can be things in your household. This can include toxic cookware, body care, and plastics. So try your best to incorporate more non-toxic products, and we'll touch more on this in the next module. You'll also want to make sure that you get enough exercise, but also get enough rest. You don't want to overdo it. There is a sweet spot with exercise, and you want to focus on having good sleep habits and feeling rested in the morning. You might also consider acupuncture and working with a functional practitioner. Now let's touch on some fertility supporting nutrients. So vitamin A, like we said, can be very supportive for reproductive health. This includes foods like carrots, sweet potato, and spinach, which gives you that beta carotene again. But we can also get some preformed active vitamin A from animal foods and dairy. And this will be very supportive for sperm production and maintaining healthy egg quality by promoting cell growth and differentiation. Coenzyme Q10 or CoQ10 is found in foods like strawberries, chicken hearts, fatty fish, other organ meats, and other whole grains. CoQ10 acts as an antioxidant, improving sperm motility and supporting egg quality by enhancing cellular energy production. Omega-3 fatty acids found in salmon, flaxseed, and walnuts. Omega-3 supports fertility by improving sperm motility, regulating hormones, and enhancing uterine blood flow for better implantation. Folate is another fertility nutrient that many of us have heard of because it helps prevent the neural tube defects. So this includes things like leafy greens, beans, and then different fortified cereals. Folate helps to support DNA synthesis and cell division and is crucial for egg development and reducing the risk of chromosomal abnormalities. Now, some people do have genetic SNPs, which doesn't allow them to fully utilize folic acid conversion, and therefore, when we're supplementing, we should be using methylated folate. So these generally are higher quality supplements and are not your generic drugstore prenatal. Choline is another very important fertility food. So this includes eggs, chicken, liver, and Brussels sprouts, which also helps the formation of that neural tube along with folate and of cell membranes to support fetal brain development during pregnancy. Zinc is found in oysters, beef, and pumpkin seeds, and zinc is essential for sperm production and maintaining normal hormone levels and supporting ovarian function. Vitamin C and E can be found in citrus fruits and different nuts and seeds like almonds, and these provide antioxidants which protect sperm and eggs from oxidative stress, enhancing overall reproductive health. Vitamin D can be found in fatty fish, egg yolks, and fortified dairy, and these play an important role with hormone regulation and may improve ovarian function and sperm quality. And women who have low vitamin D are more likely to experience miscarriage and fertility challenges. Selenium can be found in Brazil nuts, tuna, and sunflower seeds and can help protect sperm from damage and support the healthy function of testes and ovaries. N-acetylcysteine or NAC can be found in supplement form and in protein-rich foods, and NAC boosts antioxidant levels, reduces oxidative stress, and supports ovulation and sperm health, and may even help thin cervical mucus to allow for better transportation. L-carnitine, which is found in red meat, poultry, and dairy, can help improve sperm motility and energy production, making it critical for male fertility. And that is all for this lesson. I hope that gave you a good overview on pregnancy planning and different nutrients to help support your fertility. And in the next lesson, we will be talking about postpartum and breastfeeding.